I remember taking him to the airport. If he started to detox on the flight, he was concerned about that. So I'm like, well, let's get you some food and everything else. He was making phone calls.
Attention on the concourse. This is your final boarding call for Jeff Flight 1.
And then finally they called his flight. He was the last one on, and I just remember as he was walking down the ramp, I was walking on the other side with him all the way down. My good memories of Colin are overshadowed by two lasting memories that I have of him. One being when he was walking down that ramp to get on that flight, when he turned around and said, "Dad, I'm gonna be okay." And then waking him up and performing CPR on him. They're the two lasting memories I have of him. I'm sorry. He wanted this to work so badly. I know that of all the time that has passed and everything else, had Colin made it, I think he'd be clean today.
This is the worst drug addiction epidemic in United States history. We have never experienced anything like this before. It's the worst epidemic when you measure the number of people who are dying of overdoses, and it's the worst epidemic we've ever experienced when you look at the total number of Americans affected. Opioid pain medicines are drugs that come from opium. Hydrocodone, which is Vicodin, oxycodone, which is an OxyContin. We would call them semi-synthetic because you start with something natural. Heroin, obviously, also comes from opium. Heroin is also semi-synthetic. The effects that hydrocodone and oxycodone produce in the brain are identical to the effects produced by heroin. An experienced heroin user can't tell the difference between one or the other. And so when we talk about opioid pain medicines, we are essentially talking about heroin pills.
Some patients may be afraid of taking opioids because they're perceived as too strong or addictive. But that is far from actual fact.
The reason we're experiencing an epidemic of opioid addiction in the United States is because the doctors started to prescribe opioids much more aggressively.
Since I've been on this new pain medication, I have not missed one day of work, and my boss really appreciates that.
We were responding to a brilliant marketing campaign that had been launched mostly by Purdue Pharma, the maker of OxyContin, in 1996 when it put the drug on the market.
It's not acceptable to say, "I don't believe in using strong pain medications."
Doctors in the United States started to hear that we had been under-prescribing opioids, that we were allowing patients to suffer needlessly because of an overblown fear of addiction.
I feel as though the opioids have given my life back to me.
You can be more compassionate if you prescribe more opioids, and as we responded to this campaign and the prescribing went up, it led to a public health catastrophe.
Colin was born in December 1990. He was a energetic, fun-loving child growing up, always had a love for sports.
Hi, Mom.
All right.
I mean, from the time he was a little kid, I would have off on Sundays, and I would have a lot of errands to run. This is going to make me laugh and cry. And we would say, come on, boys, we have to go run a couple errands, and they would be all in their football jerseys, and Colin would be, but Mom, the football game's on today, we can't go anywhere. Sports was a huge, huge thing in the house.
I guess it happened during his freshman year of high school, where he had torn his rotator cuff. Colin had tried out and was able to make the junior varsity baseball team, hardball team. And Colin was a very fast pitcher. He had a really, really good fastball. But because he threw so hard, he actually tore his rotator cuff. That was his first sports-related injury that actually required surgery. After surgery, he was released back to home with a prescription for Percocets. He was given, I would say, probably like a 30-day supply with, instructions on how to take, and if pain increased, then give him more pain medication. But that was his first exposure to Percocet. We did not realize that Colin was going through any type of issue with the pain medication until Colin actually came to us and thought that he may be addicted to the pain medication. Colin didn't hold anything back. He was very honest about his addiction.
Colin must have been a functioning addict because there was no signs at all that would have given us the clue that my son was an addict.
Each time we're trying to manage his pain the best way we can without giving him the Percocet, the Oxycontin, and everything else. But at that point, Colin's body was so accustomed to the abuse that he was putting his body through, from the on-street Percocets, getting painkillers on the street, that it just wasn't working.
He said that the pills got to be too expensive. They were like $30 on the street for one. So he ended up turning to heroin, which most people do. I knew so much that my husband didn't know. It was hard. But he would come to me and tell me things, and I didn't want to
Alienate him.
Right. I wanted him to trust me and to be open and tell me. So I remember the day that I knew that Colin needed to rehab again. He needed to do it. So we went to a doctor visit, which his doctor was absolutely amazing. She specialized in addiction.
I first met Colin in 2012. He came to me for treatment for opioid addiction. At that point, he was already using heroin intravenously. So we had to do something because the drug use was escalating, and we feared for his life. They, as a family, made a decision that he would go to rehab. I certainly was in favor of it, and Colin went to rehab in Florida. Colin was, he just kind of stuck out. He was a very sweet kid. And there was an innocence about him. And, I have a very special place in my heart for my addiction patients, but Colin was very special. One of the last things he said to me was, I know how much I can use without dying. And that stayed with me, obviously. after everything. He went to rehab, and Bobby would give me updates on how he was doing, and I was really happy that he was getting clean and was doing so well, and was looking forward to seeing him when he came home.
My son really did great through this rehab.
He was a changed person when he came home.
Totally.
He was a changed person.
There was something going on that he got hit with when he came home and I guess he couldn't deal with it. A couple hours later, my husband said he got up in the middle of the night and he could see Colin's light under his door on. And he said, I don't want to go in there and bother him. He just got home. I want to give him his space. And then 2 o'clock rolled around and he got up and checked on him, and all I could hear was my husband screaming when he opened the door. My husband's trying to do CPR. My other son's in the bedroom down here. He comes running upstairs. Now he's doing CPR and I'm on the phone with 911. We were screaming so much the neighbors all heard us in the dead of night.
It's my lasting image of my son.
I feel like God took my son from me so that I would suffer, so that I can help other people, so nobody would ever have to suffer like this. Because it's the worst. It's the worst pain ever to lose a child. And I don't want to see anybody else go through it. That's why we're out there fighting. We're not fighting for our child. We lost our child already. We're out there fighting for your grandchildren, your children, our future. That's our goal here, and we're not going to give up. And we do it pretty much all in my son's name. We go out there to keep his name alive. I truly believe that's why I am here. That's why we're here.
Colin's not with us anymore, but we do try to spread awareness back home where we are. As a parent, we were so uneducated. Colin was an addict at 15 when he was being treated for sports injuries. We were so uneducated. Now we want to give that back to the parents because that's where it all starts.
Right.
Some states have passed laws limiting first-time prescriptions. Most states have gone with a 7-day limit. New Jersey went with a 5-day limit. A 5-day supply of opioids should really be more than enough for the vast majority of patients who might need an opioid prescription because they just had major surgery or serious accident. If a patient has pain so intense that they need more than a 5-day supply, there's probably a good reason for that patient to be evaluated by their medical provider. And New Jersey did something else that was unique. They passed a law mandating that prescribers warn patients that opioids are addictive drugs when they prescribe them. You have many people who are prescribed opioids, or their children are prescribed opioids, and they have no idea that this is a drug that's as addictive as heroin. It's likely that if parents or even the prescribers understood how addictive these drugs were, they would be prescribing more cautiously.
Several weeks after his death, I did go through his suitcase and found his diary that he kept in rehab. And it was very telling of his mindset. He was going to beat this. He was going to be something, somebody. He knew that he had self-worth.
Absolutely.
I don't think there's any hope if everybody does not join in together and try to beat this disease. I just feel like we're being set up for failure if we're not being educated enough